My training was a 7-year apprenticeship with a Korean acupuncturist who did Japanese meridian therapy. I realized that there was a wall with acupuncture, especially with people that were very low in energy. Acupuncture is very good at moving around energy. But if the person doesn't have a lot of energy, it's less effective, you know. So I first started with diet to try to, get diet going. And for me, back in the 70s, that was macrobiotics. My original entry into Chinese medicine was because of Tai Chi and Qigong, which for me started before Chinese medicine. My experience in China was really life-changing. I wrote the first version of this book before I went to China. I like to say I wrote the first version before I knew anything. A year in China really shaped me, and I was so impressed with what I saw there, and so overwhelmingly impressed. The hospital I worked in Beijing was 1,500 outpatients a day, 700 beds, inpatient, all with herbal medicine. The acupuncture department in this hospital is very small, so it was all herbal. I studied there. Originally, there were 7 of us. We were all herb teachers. 5 of us knew some Chinese. And we started with 33 teachers, and that lasted for about 4 months. And then more and more of us moved away, and finally there was 2 of us staying a long time. And for me, I concentrated with 3 teachers, mostly because I had good personal relationships with them. Today's material, you can see, we're going to cover wind heat, heat toxins, nasal and ear, lung, and bee syndrome. Tomorrow we're going to discuss trauma, digestion, gynecology, liver, disturbed Shen, kidney, bladder, eye and vision, and then the tonics. When I talk about that formula, say the availability, and there'll be a bunch of formulas with code letters on the end. So if you see a code letter, this is what they mean. Very convenient way to say, well, I carry golden flower. What do they got for this problem? Oh, I have that in stock, or I need to get that, or whichever company you like. I am not partial to any one company. I think all the companies use high quality herbs, and it's all about the formulas and the percentage ingredients that are in the formulas. So these are 3 bigger volumes I recommend if you want to go further into these prescriptions. Bensky has very good material, and so does Chen. Ellis sums them up in 1-pagers, and these are the books that it refers to on page 58. Finally, on page 59 is the codes to the herbal category. So if you look back again at Yin Chow on page 8, for each herb there's a letter code, and those code letters on the last page here. So it's just a quick way to say, what's that herb do? These are 30 categories that herbs are put into. So it's just a quick way to go, where's that herb? What kind of herb is that? So when we talk about disturbed Shen, what does that mean? Where does it look like? What are the differentiations? Why would you use one formula versus another? I welcome any questions that have to do with clarifications about what I'm talking about. What I'm most interested in is clinical situations that are puzzling. The kind of questions I'm thinking about is, well, what do you do if? How do you know if it's this or if it's that? Those kind of questions are more interesting. So I want this to be informative. I want you to go home and have stuff that you can use. You'll know how to use products, when to use products. Now this is on 50 products. My Who's Got What book must list 1,500 products. That's how many products there are out there. My book has 1,250 products, of which there's 850 formulas. So these 50 today are the most important. When I say most important, I mean these are ones I use all the time. And that's why I'm talking about it, because I think they're clinically relevant.